explain a little bit more about the methodology behind your toxicological risk assessment that you're performing.
Yeah, that's a great question. So, toxicological risk is a component of the unique hazard risk of each ingredient coupled with the exposure level. So, I always like to describe this in terms of alcohol. Most of us are all very familiar with alcohol. So, for example, ethanol, that is the compound that has the inherent risk in alcohol. And so we understand the toxicity of ethanol. Then you compare with the exposure level. So, for example, 1 glass of wine, you're probably going to feel totally fine. You'll wake up the next day, feel totally great, go about your day, no problem. So, that is a very low exposure to ethanol. So, the risk is very low. But then let's say, after I do my presentation, I'm really excited. I'm going to celebrate and I drink a whole bottle of wine. So that's a much higher exposure. And while I'm drinking that bottle of wine, I might lose a little bit of balance, right? I might say things that I think are really funny, but maybe not be so funny. And then the next day when I wake up, I'm probably going to be very dehydrated. I might have a headache, but ultimately, I have a really great breakfast, and by the end of the day, I feel totally fine again. So the risk between, a glass of wine and a bottle of wine is a little bit higher because we're getting exposed to a higher level of that ethanol. So that's the idea behind a risk assessment, because nothing, and I mean nothing in this world, is 100% safe. So it's really important to understand the inherent risk of that individual component, but then also to understand how much of that component, how much of that ingredient can a consumer be exposed to without having any risk, or without having any, the risk is at a negligible level.
Mm.
So the methodologies that I employ here at True Terpenes includes surveying all of the publicly available data on each individual ingredient, compiling all that, reading it, understanding the conclusion, and then I perform a set of calculations, which is very standard in toxicology. And so these calculations do things, for example, if it was a study with a rat, we need to understand what that means in a human. So I do a calculation to put it into the levels that a human would be exposed to. Then I need to put it into the exposure of a cannabis consumer, right? So I understand how much is a cannabis consumer vaping every single day? How much of this extract are they being exposed to every day? So that's a really important calculation. Then once I get that once I get that answer from the human exposure level, I apply a set of uncertainty factors, or safety factors, they're sometimes called. And so what that means is we found this limit from a study where there was no adverse events to the rat, but we're not 100% sure if a rat is totally equivalent to a human. So we're going to apply this uncertainty factor, which brings this no effects level down, let's say 10 times. So now it's a 10 times smaller limit. So it's going to be more conservative limit. So we can be more confident that that limit is not going to cause harm to our cannabis consumers in the final product. So that's kind of a brief overview of, what a toxicological risk assessment is and how I perform that.
Excellent, excellent. So in your example with alcohol, you were mentioning how ethanol is sort of the compound that can cause harm, I guess, for lack
Right.
of a better term. So when you're looking at